You are watching the Deadfoot Diver podcast with Curt, the Deadfoot Diver.
Welcome to the Deadfoot Diver podcast, where we talk about everything diving, technical diving, and especially the benefits of diving with disabilities. I am very pleased to have on today with me the former head of the Long Beach Hyperbaric Unit and the author of Diving Science Revisited, Dr. Michael Strauss. How's it going, Dr. Michael?
Well, it's going well. I have my irons in several fires, including hyperbaric diving and orthopedic surgery. So keeps me busy and active.
Yeah, I guess. I mean, you were telling me the other day that you're almost 85 and still working full time.
That's right.
Which is
feel very
amazing.
fortunate and feeling comfortable in doing such.
Yeah, that's amazing at your age that you are still an active doctor. So let me go by first asking you, how did you first get into diving and then into hyperbaric medicine?
Well, I have this affinity for water-related activities. I was a competitive swimmer in my youth and adolescence. And then I read the book, The Silent World, and that really influenced me. And in high school, I did a book report on 20,000 Leagues Under the Sea. So I knew I wanted to do nuclear medicine, nuclear submarine experience. So I entered the Navy and went into the submarine medicine program, where I was on nuclear submarines, and then also got a very excellent background in diving and had billets with divers in Vietnam and the Philippines. In the Philippines, I almost scuba dived every day and did some breath hold diving that was pretty impressive. Unfortunately, one of the Navy SEALs dove at the same place that I set my depth record at and had a blackout on the way up and actually died. So that area has a spot in my heart. The situation was, after my Philippine and Vietnam experiences, I went to the SEAL teams as the medical officer there. And once or twice a week, we did dives. They were supposed to be training dives, but actually these people were coming back from Vietnam and from the Philippines, and this was their reward to go on dives almost weekly. So got a lot of experience in that. And then after that, I went into an orthopedic surgery residency and worked in Newport, Rhode Island. And I was enticed to come to Long Beach, California, by my mentor, Dr. Hart, and got a real excellent background in hyperbaric medicine from him. And he encouraged me in a lot of activities, such that almost every year I'd run a diving medical program, and I've dove all over the world, from Palau, Pohnpei to the Red Sea, and we would conduct the diving courses and also dive at the same time. So what can I say? Going back a little further, my records academically were good, but they weren't like so incredible that they would stand out. But I think because I was a swimmer, I got into Stanford based on my swimming, and did get a grant and aid in swimming to go there. And then to get into medical school, they saw that that I didn't just study the whole time, but I did swimming and was on the swim and water polo teams there. So this is how water-related activities influence my whole life.
So what age were you when you did your actual first dive?
Well, I took a diving course locally when I was about 15 years of age, but they didn't let us use scuba gear. And I felt, well, I could scuba dive. And our one experience out of the pool was diving in a river about 50 degrees water temperature. So I got experienced hypothermia, and that was about the summation of that dive activity. Really, I didn't get deep into diving until the Navy when I entered in 1967. And there did all types of diving, mixed gas diving, hard hat diving, helium oxygen diving, and all. And then I related my experiences after the Navy with submarines,
Wow.
Philippines, and
So you
etc.
actually did mixed gas diving and stuff too as well.
Yes. And in the SEAL teams, I trained on their Mark 15 mixed gas system as well as the old oxygen system, which was the Emerson at the time, and a Mark 6, which was a semi-closed circuit system. So have a lot of experiences with different types of diving equipment. Oh, what was it? Is that the old deep sea diving helmet, the Mark 6, I think it was, or
Mark
something?
Five or Mark
You
Six.
know, what you see the pictures. And also the helium oxygen diving rig was something else. It weighed about 200 pounds, and you had to have a lift to get you into the training tanks, a hoist. And you had 50-pound weights on your boots there to counteract the inflation of the suit with helium.
Wow. I would love to dive with a Mark Five. Actually, I've dove with a Miller before, and that was pretty cool. But I have not dove with with a Mark helmet yet, which is on my bucket list of things to do. So let's get into. I want to ask you a bit about your hyperbaric medicine and stuff. So you actually, how did you end up getting into specializing in hyperbaric medicine?
Well, it was sort of a whim. When I finished my active duty obligation with the Navy, I had a choice of re-enlisting and staying on. I had 9.5 years at the time, or getting out and just doing pure orthopedic surgery. And then Dr. Hart, my mentor, as I mentioned, invited me to come to Long Beach. Well, my wife was totally opposed to that. So I had to sign a contract that said, excuse me, 1 year with Dr. Hart, and then we'd go anywhere you want, including back in the Navy. So 1 year got to be 2 years because I was in the middle of projects. And then 2 years, we got our kids in school and friends, got to be 4. And now I've been here 47 years. And of course, broke that 1 year promise. And so, working with Dr. Hart, he was so encouraging. He was a retired Navy captain. So he was all for me to do my Navy work. So I stayed with the Navy Reserve SEAL teams and got to do SEAL team activities on my 2 weeks of active duty training, also orthopedic activities. For example, during one of the 2 week training periods, I happened to be in Italy when the earthquakes occurred in Turkey. So I was the orthopedic surgeon that dealt with the trauma cases in Turkey that
Wow,
we had set up with the Navy mobilization unit.
wow,
So,
that's amazing. So I want to touch on hyperbarics a bit as far as I know that recently there I've been seeing almost on a weekly basis, unfortunately, of how a lot of hyperbaric chambers are starting to actually close and not handle divers at all.
Yes, that's a major concern. When I got involved with Dr. Hart, there were about 50 chambers in the United States, and they handled all emergencies and they handled all diving problems. There was no refusal of a patient. Well, as it turned out, Medicare was looking ways of reducing spending, so they set up what they called was DRGs, diagnosis related groups. And so if you came in with a heart attack and also had, say, a dead limb or ischemic limb and needed hyperbaric, they wouldn't reimburse for hyperbaric. They would only reimburse for the diagnostic related group for the admission. But in exchange for giving up using hyperbaric as an outlier and being reimbursed for it, they said we'll pay for outpatient hyperbaric treatments. So this facilitate the development of hyperbaric units associated with wound programs throughout the United States. And about 1,500 different facilities now have hyperbaric oxygen, but only about 70 will treat emergencies. The others are dealing with non-emergency situations, and it's easy to say you can have hyperbaric if you pay the fee, and we'll treat anything that comes aboard. So I'm very concerned about the direction hyperbaric medicine is taking at this time, and some way or another, we have to get a reimbursement for treating emergency situations. And this will stimulate a lot of interest in the academic communities because there's a wealth of opportunities for research using hyperbaric, not only on the present conditions, but on conditions which we call off label at this time, but there is some justification for using hyperbaric oxygen treatments.
And what kind of conditions are those?
Well, acute strokes are one, and acute head trauma. That is during the first 6 hours after the injury. There are mechanisms of hyperbaric that work specifically to counteract the effects. One effect is swelling, and hyperbaric causes vasoconstriction, so there's less blood flow and less swelling. But this is compensated by tenfold increase in amount of oxygen each drop of blood carries. So you're maintaining oxygen to tissues that aren't getting enough oxygen, but still not contributing to the swelling. So that's one condition. Another condition is sports medicine. Athletes are using the hyperbaric chamber surreptitiously. We hear that the pro athletes, they have their own chambers. In fact, in one of a textbook that I contributed to, we found 20 different companies selling home use hyperbaric chambers. You put them in your living room and you take a scuba tank and, blow up the chamber. I shouldn't use that word blow up because we're really concerned that there'll be an accident and then hyperbaric will be erased off the map because there's no supervision of those treatment. But sports medicine, in terms of injury recovery, looks very promising because what is the injury? It's damage and bleeding. And if you cut down the blood flow, but still maintain oxygen to the healing tissues, you're going to have good results. And my colleague in Japan has done a lot of work with animals and some with humans that have shown the benefit of this in sports medicine. Another indication is a near drowning in those situations where the patient is recovered but is not alert or fully conscious. And that's when the swelling and the lack of oxygen to brain tissues is most needed. And that's where hyperbaric would be very valuable in those initial few hours. And actually, there's a whole list of conditions in the fifth edition of Hyperbaric Medicine Practice, which is considered the Bible of hyperbaric medicine, if I can use that expression. I wrote a chapter on off-label uses, and I listed about a dozen different conditions where hyperbaric oxygen has promise.
Wow. Now with hyperbaric chambers, I know in Canada I don't see it as widespread as a lot of. I don't know of a lot of people or have heard of many people having hyperbaric chambers here or private ones, unless they're a high-tech diver. There's a couple I know, but other than that, but in the States, it seems to be like there's a lot of private facilities that offer hyperbaric medicine now, correct? And what are some of the issues that you guys have been seeing when you have small companies like this that are offering hyperbaric services that aren't maybe treating them for something that should be treated by hyperbaric medicine?
Well, this is the problem, as I introduced. That is, these chambers are treating diabetic foot wounds, and they're basing it on a very archaic grading system, which is easy to upgrade and say, oh, this patient needs hyperbaric based on this archaic grading system, rather than using objective parameters. For example, most diabetic foot wounds do not need hyperbaric oxygen. They have underlying deformities or deep infections, which are handled with surgery or offloading. But there is a group that have what ischemia, which that means poor blood supply to the area. And you can measure this with transcutaneous oxygen measurements or just a clinical examination. And this is where hyperbaric oxygen should be used for that diabetic foot. But there's abuse because of upgrading, and there's automatic reimbursement for anyone that says this is the patient by this grading system qualifies for hyperbaric treatment. Unfortunately, the very important journal called Diabetes Care had 3 articles about looking at hyperbaric oxygen based on this archaic grading system. And they said it didn't show any benefit to statistically to the patients that didn't get hyperbaric. Well, they treated patients that needed the deformities addressed and the deep infections addressed, not the ones that specifically were ischemia. The other big use of hyperbaric is decisions made by surgeons. We create flaps all the time, to get exposure to whatever surgery we have to do. And many times those flaps are at risk of breaking open. Dehiscing is a medical term. And the time to give hyperbaric is right from the recovery room when you first notice this. And this is not a decision of a hyperbaric person or using the archaic grading system. This is a clinical observation by the surgeon. But if these limited chambers, as I said, about 70 will treat these, but there's 1,500 other chambers in the United States that won't, you can see the void, the problem.
Yeah, I mean, there was not too long ago, I remember reading about an instance in Michigan where a chamber actually blew up, and it was a child that was killed. And they were treating the child for ADHD with hyperbaric medicine.
Yes, this is one of those situations where if you pay the fee, they'll treat anything that comes aboard, and there's not good follow-up information, whether it is beneficial or not. As you know, in medicine, there's something called the placebo effect, where you give a sugar-coated pill and tell them this is what it's supposed to do. And a certain percentage of patients will be benefited by this. So there's a lot of room for this type of placebo effect on off-label uses of hyperbaric oxygen.
Yeah, which is unfortunate that you have people taking advantage of people with medical issues seeking help just and then give them a false hope that, oh yeah, this is I know I have ADHD. I would not think of going into a chamber to treat my ADHD.
Yes.
But yeah. So I want to talk a bit about your book here, Diving Science Revisited, that you sent me. Thank you. It's the awesome book. Very, you guys need to pick up a copy of it if you haven't yet. This covers everything that you could possibly want to know about diving medicine. It's a pretty amazing book. So I'd like to talk a bit about first of all, let's talk a bit about scuba diving and the older age people, because unfortunately I fit into that category now. I never thought I'd say that. So, what types of things should an older diver be cautious about and have to look out for more than somebody who's, say, 20?
Well, as I point out in a chapter in Diving Science Revisited, it's on older age divers. There are three considerations. One is mobility. So if you have trouble standing or walking, it's going to be difficult putting on your equipment and exiting, or if you're making beach entries where there's cliffs and elevations to negotiate, this can be a challenge. So that is one thing. Second thing is comorbidities. If you have decompensated heart disease or decompensated pulmonary disease, these are reasons that you shouldn't dive. And the third reason is diving should be fun and enjoyable. At a certain stage in a person's life, because of joint stiffness and back problems, etc., it's more of a burden to put the equipment on and dive than it is to you go ahead and say that, yes, I dove at 85 years of age, you see. So these are some of the decisions I'm making in my mind right now. Fortunately, my mobility is fairly good, but I'm not sure about my my motivation to go through these challenges that we see facing divers.
Now you actually have a couple of grandchildren who you said who are just getting of age to be getting into this. So I don't know. They might be wanting to drag you in the water.
Yes, well, that would get me back in the water. Now, I'm pretty good at snorkel diving too, and so you're not burdened with a lot of equipment. So sometime I may draw the line and say I'm only going to do snorkel diving, and that's one of the chapters in the book. Also, using breath hold diving and the different challenges that can occur with that. My grandchildren are becoming pretty confident in the water with swimming, but I don't propose that they do scuba diving till the same time that they drive a car, because
Really?
you need to have judgment, and judgment comes with age and experiences. And this is what I did for my two sons. They didn't scuba dive until I think they were 21. Again, using that maxim, but they swam and snorkel dove with me at much younger ages. And there is a chapter in Diving Science dealing with diving in the younger age individual. So for those people that have kids, they can see what I say. I take the very conservative approach, as you would see in the chapter.
Yes. I mean, now you can dive at like 8 or 10 years old. And I mean, you see
Well,
them, they even, what I think is even crazier is that they allow kids that age to do a shark dive.
yeah, I have in the Diving Science Revisit textbook, my grandson, I think he was about 3 years old. We did this Photoshop picture with him holding a scuba regulator in his mouth and goggles on his head. And the comment is anyone could breathe with a regulator, but his sweat the judgment that comes with it dictates when they should actually get in the water.
So, did your kids though bother you a lot younger to try scuba diving, even
Not
with your
really.
little?
They would go on our some of the diving trips with us, and they would do their snorkeling while we did our scuba diving, or I would join in with snorkeling in between dives. So they really didn't complain about that at all.
So, I actually want to ask you about snorkeling and free diving now that we're on that subject, because I did not realize until this past year when I got into diving about the odds of getting bent actually doing free diving. So,
Well, you have to be pretty extraordinary diver to do this. For example, the studies out of Sweden where they generated decompression sickness, these divers were diving for several hours, and their surface intervals were less than their time on the bottom because they were so well conditioned, and they were going to 60-foot depths. And after several hours, I have it in my book the exact time in this situation. When they came up, they did get decompression sickness, and when they put them in the chamber, they resolve their symptoms. And then in the South Sea Islands, these pearl divers and coral divers, they make very deep dives, and some of them come up paralyzed. And this is with breath hold diving, and they don't have the chambers available, so these people are left with residual paralysis. So this is part of education and a serious problem. The situation is gas goes into the tissues faster than it comes out. So you have to, the toll, I think I use a quotation that a famous person in diving made, but you pay the toll when you do your ascent and surfacing. That's one thing about my dive text, that I classify diving injuries and when they're likely to occur. For example, on the surface and entering the water during descent, such as ear squeezes, bottom problems such as nitrogen narcosis, and then ascent problems, which are namely arterial gas embolism and decompression sickness.
so have you actually had to treat a lot of guys for decompression sickness from free diving?
From free diving, I only specifically recall my Navy SEAL team colleague who died free diving at the spot that I had set my depth record at, and it was a matter of blackout on the way up that led to his demise.
Wow. And what was your depth record that you set?
Well, it was nothing sensational. It was only 80 feet, but I didn't
Oh,
want
that's cool. I can do 80 feet. That's pretty impressive.
but I didn't have a buddy, so I violated the first rule. I did have a buoy line, so I did have a line, and 80 feet is where I hit the bottom, so I couldn't go any deeper. So that probably saved my life.
I give full. And how old were you at the time when you did 80 feet?
I had another diving experience.
How old were you when you did 80 feet?
Let's see. Well, 27.
That's still impressive. I mean,
Yeah, I still my last scuba dive, I was snorkeling to 30 to 35 feet. And it's very
wow.
interesting with this breath hold diving. The first day I could only stay underwater for about 30 minutes, but by the end of the dive trip, I was staying a minute and a half on the bottom and a minute, in recovery. So you can really condition yourself very quickly with breath hold diving if you do it repetitively. I might relate a diving experience that I had when I was about 16 years of age. I was try to be boastful how far underwater I could swim. And I was told, or, the information in the different subtle sources said, if you hyperventilate, you can hold your breath longer. So my record for underwater swim was 50 feet before. And so I was at this swimming pool, and I said, I want to set a new record. So I hyperventilated till I was numb and tingling all over. And then I got to my old record of 50 feet, and my arms and legs just felt dead and numb, but I had no desire to breathe. I touched the wall at 60 feet and sunk into the water. Now, I did have enough sense to have a dive buddy walk along the deck, and as soon as he saw me sink, he immediately brought me to the surface. I had aspirated water, so I coughed and barfed and all that for a few moments and recovered and went on with my diving experiences after 17 years of age. So that's one of the stories I bring up in examples of breath hold diving type of
I see
accidents.
these guys free diving, and they're insane. I mean, there's a guy up here. There's a shipwreck that I have dove on multiple times up here back in the 90s. I'm going to do it again this summer, called the Arabia. It's a schooner, and it's in 110 feet of water or whatever. And I was going through YouTube the one day, and there's a guy on there that actually free dives the thing. And he's down there for like 2 or 3 minutes and swims around the whole thing. And I'm like, you're nuts, man. I would never do that. Like, no way, no how.
Yes. Well, sometimes on these scuba diving trips with the different doctors, they're diving at 30 to 40 feet, and I'll breath hold down and watch them for a while and then come to the surface. Now, that's one rule I have: never accept a regulator when you're breath hold diving to stay underwater longer, because it's so easy to forget that to exhale on the way up, and you're underwater breathing the compressed air. So that's a no in my book, to breath hold and mix it with breathing with scuba gear.
Yeah, that would definitely be a bad mix for that one. So tell me, since I'm a cold water diver, what kind of extra risks do I have involved in cold water diving, especially at an older age? As I repeat that I'm in an older age now. Hey, everybody. Thanks for watching. Please remember to like, share, and subscribe. And by the way, we're also on your favorite podcast platforms now. We are on Amazon. We are on Spotify. We are on iHeartRadio. We are on Player FM and Podchaser. All of the descriptions are going to be down below, so make sure you check us out. Thanks. Have a great day. And remember, grab an adventure and live.
Well, hypothermia is sort of insidious. It can come on and you don't appreciate it. You may feel uncomfortable at the beginning, but it can influence your mentation, and you can do things that foolishly. You lose tactile sensation as your extremities become cold. So if you have to pull, say, a toggle for inflating a buoyancy compensator, you might not be able to handle that. Or if you have to read your compass and depth gauge, and you might find it difficult to do that. I had a lot of experience, and that's part of my bio, which I'll mention shortly, with the Navy dealing with the many submarines where it brought SEAL team divers from a submarine to shore. We were in 40-degree water, and they were spending 6 hours in standard 5H inch wetsuits. And we monitored them, and their core temperatures didn't drop very much, but we had thermistors on their hands, and they dropped down to the same temperature as the water. And you can imagine that cold water interfering with their tactile and ability to handle the mini submarine. So, really big appreciated what the effects of hypothermia can be.
So what kind of just because you're the first person I've had who has been involved with the Navy SEALs on, so I actually want to get a Navy SEAL diver on here really bad to, to interview them. So if you got one that you can throw my way later, I would love to hear from them.
You
So
would, I,
with the Navy SEAL training, I mean, they do. I've seen videos and stuff, but they do some pretty extreme stuff. So tell me about some of the stuff that you would have to do while you were and you monitored them for while they were doing their training.
well, first of all, the Navy SEAL divers are shallow water divers, basically. Almost all their activities are going to be in 30 feet of water or less. This is different than harbor clearance unit divers that go several hundred feet, or rescue divers for submarines and such. So, their dives are superficial, and mainly it's a matter of conditioning that they can swim long distances underwater using the gear. And of course, with mixed gas scuba, you can spend 6 hours of bottom time. So that can result in long swims and long periods. But generally, decompression sickness is not a problem because they're staying at the shallow depths. More concerns are failure in the equipment, such as not having the right oxygen mixtures. So they pass out from hypoxia, but their carbon dioxide, which stimulates breathing, is not elevated because of the filter system to remove carbon dioxide in the gear. Now, SEAL teams, they start out with a lot of swimming activities and open water swims. That's another part of my story. When they had their open water swims at an island off the coast, it's called San Clemente Island. It's a Navy training facility. Rather than staying aboard the rescue boat, I would get in the water and swim with them. And I usually was able to be the first one to reach the end point. So
Really, you can beat
it
the Navy SEAL guys.
it relates to my swimming abilities. And then after that, then they get trained in regular scuba gear, open circuit. Then they get trained in the oxygen suit gear, which now is the Draeger closed system gear. Before we carried the oxygen system on our back, but now the Draeger, they have it strapped to their abdomen. And then they go into the Mark 15 and subsequent developments, Mark 16 and such. As far as I know, they don't use any surface supplied gas in the SEAL teams. They used to do submarine escape training where they would go into a tank and then practice exiting from 30 feet depths. But I think the Navy has discontinued that. I know in Coronado, where the Navy SEALs are trained and they have their duty stations, they tore down the escape training tanks. So, as I said, I assume the Navy's not using that training technique anymore.
Ah, wow, that's really interesting. So when with that and the Navy SEALs, oh, one thing I did want to ask you about the cold water with since like they were in the cold water so often, how often or did you ever have to treat any of the SEALs for decompression sickness just due to the demands of their job?
No, I don't recall any cases of a SEAL. My 30 years of affiliation with them, that we treated a case of decompression sickness. We've treated blackouts and we've treated concern about arterial gas embolism associated with blackouts and such, but not with decompression sickness. So it speaks well for their training and their discipline, that they don't do things that they're not to do on their missions and their training exercises.
Yeah, which is really cool. Yeah, the Navy SEALs, they definitely do have a demanding job, that's for sure, and their training. So did you see, just on another quick note here, did you see a lot of guys drop out of Navy SEAL training?
Well, I didn't personally see them because I would hear when I was a medical officer on active duty, that was in 1969 and 1970. They would start with a class of 100 students, and about 20 would be able to finish the program. Now they're starting with classes of 200, but again, the number of completing the program, the training, is still around 20 or 30, as
Wow.
have been informed. Now, those aren't exact figures, so don't go around and say Dr. Strauss had only 20%.
Well, this is going to be on the internet.
No, it's about 75% or more drop off because the rigors of the training.
Wow. Yeah, that's pretty cool. And I've heard that a lot of people don't even survive even the first week of it.
Yes.
Or whatever, they crash out. So I did not realize, though, that they took like 200 and only had like 20 or 30 about that pass. That's crazy with that amount of numbers. You would think it would be a bit higher than that, but so with cold water diving, how much does it increase your risk of decompression sickness? Because I have heard this from all kinds of people and different things, and also how much more of a risk is it in cold water if you're an older diver with decompression sickness?
That's a very astute question, and I don't think there's been much information on that, and it deserves to be investigated further. Being a student of physiology, not from medical school, but from my diving medicine experiences, we know that when you're exposed to cold water, your body makes adjustments. It wants to preserve the core temperature, and this is at the expense of the extremities. So the vessels will clamp down on the extremities so you don't have blood going to them. The extremities are like radiators. There's a lot of surface area to mass, whereas the core is more like a sphere where the surface area to mass ratio is the lowest possible. So this is what the body does. So if you're not offloading the gas, say during your ascent because of the vasoconstriction, then you're going to retain gas in those tissues, and they can lead to decompression sickness. Probably not arterial gas embolism or serious decompression sickness where you have intravascular bubbles, because you're not interfering with your breathing, the core exchange of gases, but you're interfering with the extremity exchange of gases.
Wow. Yeah, that's interesting. I mean, I've been definitely reading some of the chapters of your book as far as the older diver goes and stuff like that, because much as I hate to admit it, I'm 55, so I now classify as a senior. I get discounts at places I don't necessarily want discounts, but
another thing that I mentioned on older age divers is maintaining fitness. And we had one diver that had he had stents of his coronary arteries, was on anticoagulants, but he was superbly physically fit. He could kayak from Miami, Florida to the Key West on a kayak. And so he felt fully comfortable scuba diving, even with his history of coronary artery disease. So fitness is really an important consideration in the old age diver also.
Yeah, exactly. And some of us don't get enough physical fitness
In,
probably
in
than
the
we
chapter
or
on old age divers, I list some of the criteria for measuring fitness. So if people want to know where they stand, they can get a pretty good picture of fitness.
so if somebody wants to get into scuba diving, what are the top main things that you would suggest to them that they get checked out or before they decide to get in the water and throw a tank on?
Well, first of all, motivation. They want to do it. It's not because their father was a diver and they want you to be a diver. So, motivation. Second thing, and this is really important, is comfort in the water. Some people will get in the water and panic. They won't put their face under the water. These are not good candidates for scuba diving. So you have to be comfortable in the water. Third thing is fitness, and that is what I just alluded to earlier on the older age diver. So those are the three major criteria that I see. We have other subtle criteria like being able to fit the equipment. And this is one of the concerns about diving at very young age. Equipment is not going to fit very well for the younger age diver. And as they get older, every couple of years, if say you get a custom made wetsuits, you're going to have to get, their new wetsuit. The regulators and backpacks are basically geared for the adult diver, not for the youngster. So these are some of the reasons I say the younger diver is probably better off to snorkel until they're ready to drive an automobile.
You're the first person I've ever heard say that, actually.
All right. Well, I'll stand
Ever
by
say that
that.
they should wait till they're 16 to.
Well, 15 they can drive with a permit.
I mean, I took my first breath on scuba probably when I was like probably 6 or 7. I didn't get certified until I was like 20, around 21 or so. But yeah, that's the one thing that has surprised me is how young these kids are getting into diving. And I mean, like I said earlier about the sharks, I have a thing about throwing a 10-year-old in with sharks to do a feed, but there's or there was I know in the Bahamas last year at Atlantis they had an incident where there was actually, because they have a tank there with bull sharks, and you can actually go in with a helmet that they have, and I think the age is like 10 or something like that, and one of the kids was actually bit by a bull shark last year.
Yeah, that's
And
untenable.
now that to me would be like throwing chum in the water, but I would think.
I've dove many dives where sharks were present, but never had any of them show any aggression. So it felt pretty comfortable in the water with them. These were, white-tip reef sharks. They were. We actually dove with a tiger shark in the Philippines, but there were so many fish present that you had to take your hands and scoop the fish away to see the tiger shark. So I don't think they were interested in human food when they had such a source of food readily available.
Yeah. I could definitely see that.
I may relate another sort of funny story about cold water. In medical school, went on a date, and we decided to go to the Columbia River, which is where the medical school is located, adjacent to the river, essentially. So I got in there and swam in this water, probably 55 degrees or so. And I came out and I started to shiver almost to the point of convulsing. And all I had was a towel. So I told the nurse girlfriend, get on me and smother me with her body in order to try to warm. Now, shivering is very detrimental to your body because it takes blood flow to cause those muscles to lead to shivering. So that brings your warm core blood to the surface and then it radiates out through the skin. So I didn't know about diving medicine at the time or anything. I just knew that I had to try to prevent that shivering and try to get comfortable.
Yeah, you're just trying to make moves on the nurse. But I mean, you had a prime excuse for it. So, I mean, why not?
Right.
So, another thing I wanted to discuss. Now, you're 85 or going to be 85?
No, I'm 84, July 85.
July 85. Okay. So,
well, I don't call it
you
85.
actually still work
Right now,
like
I'm 48. I'll be 58 next in July. I just reverse those numbers.
You're younger than me. So you still actually work pretty well a full-time schedule, correct?
Well, I work a reasonable schedule. When I was the medical director of the Hyperbaric Unit, which I retired from about 5 years ago, I was probably putting in 80 or 90 hours a week. Now I'm probably down to 30 to 40 hours, which is reasonable. But I still have 3 wound clinics a week, one at the Veterans Hospital and 2 at our private hospital. And I do surgeries, 1 to 3 surgeries a week on cases that no one else wants to operate on because the patients are told you have to have an amputation. They refuse, then they come to me and I say, well, I think we can correct this problem with an 80% likelihood of avoiding an amputation. And almost every one of them wants to take that 20% risk. And I use hyperbaric when I think it's indicated if ischemia, poor blood flow, is a problem. So these are very innovative, resourceful type of surgeries because of each patient has a different presentation and all. Now, those people that do total hip replacements are very expert because keep on doing the same thing over and over again. All my cases essentially are unique, so it gives me a chance to express my ingenuity.
So at 85, is it partially because you don't have a doctor to replace you, or that you still just love it that much? I have to ask.
Well, it's my wife's fault. She's sitting right here beside me. You want to show your face there?
Oh, hello. Yes, show your wife on here.
Okay, this is Wendy.
Hi, Wendy. Nice to meet you.
And what Wendy says, retirement, is a word that should be stricken from the English vocabulary. And so as long as I feel comfortable doing what I'm doing.
So in other words, she wants to keep you out of the house a lot.
Well, I don't know. She usually comes with me to the clinics to help in recording data and such. So I'm not sure that's her primary motive. But the thing is, as long as I feel comfortable and competent in what I'm doing, I'll keep on plugging along. I'm working with orthopedic surgery residents, so that's very engaging and very informative. I learn from them. Every OR case is like a learning experience because of the uniqueness. Also, I have had so many experiences. I continue to write papers with the with pre-med students, medical students, and such. So pretty active academically in a very relaxed situation. That college professors have to publish or perish. Well, I can publish without worrying about perishing.
That's amazing, though. I give you full kudos for your work ethic and the amount of time that you still work full time and that you love it that much, because you genuinely can tell that you still love doing it.
Yes, I think you expressed that very nicely.
So, well, I would like to thank Dr. Michael Strauss today for coming on the podcast with me. Make sure you check out the Dive Science Revisited book, and I will have a copy, a link down below in the description so you guys can check it out and order yourself a copy of it. It is a really good resource to have for diving. Even if you are not a medical person, it is still got a lot of information in there that the average diver should read. So thank you again, Michael. And remember, everybody, grab an adventure and live.